To ask the Minister for Health and Social Care what the Child and Adolescent Mental Health Service waiting list is and what is being done to reduce it.
The Minister for Health and Social Care to reply, Mr Ashford.
Thank you, Mr President. The waiting list consists of 48 young people waiting for generic CAMS or Child and Adolescent Mental Health Service treatment, and 104 who have been referred for attention deficit hyperactivity disorder and neurodevelopmental disorder screening and assessment. Any cases received are prioritised on receipt, with new urgent referrals assessed within 12 weeks. There has been considerable investment by the Department to ensure adequate staff provision, and some of these plans are yet to come to fruition. However, an additional 11.5 medical, nursing and allied health professional posts have been introduced into CAMS since October 2016. The newly formed Community Care Directorate has recognised that there needs to be developed a more integrated CAMS service, and as a priority, plans for this will start to progress in the second half of this month.
Supplementary, Mr Speaker.
Thank you. The Minister is aware of a couple of cases that I've brought to his attention, but would he accept that long waiting times, he referred to 12 weeks for referral, are just not acceptable for acute care, and that we wouldn't keep someone with a broken leg waiting that long?
Minister to reply.
Thank you, Mr President. This is precisely where having the newly formed Community Care Directorate within the Department and more joined-up working is beneficial. One of the interesting things which I'm happy to say, which I'm going to say to the Honourable Court, is referrals. We have seen a huge amount of extra referrals into the CAMS system. So to put it into context, in 2016-17, in that particular year, there was 464 referrals into the service. Last year, we saw 595. That's an increase of 28%. So one of the things we've got to understand as well is why we are seeing the increase in referrals and actually tackle the root causes. I'm very, very big, as I'm sure Mr Speaker knows, on prevention rather than cure. And I think that is the key to this, that we've got to understand why we are seeing year on year more and more referrals into the service. It's too late once they're referred into the service to tackle the root causes. We should be tackling the root causes in society before it gets to that point.
Supplementary, Mr Speaker.
I certainly commend the Minister for his approach, and we quite agree that prevention is better than cure. In terms of how the community focus of the service is going to drive down waiting lists in the short term, I'd be interested to know more about that, and as I'm sure would many of the people who are on those 12-week waiting lists.
Mr Ashford.
Thank you, Mr President. The simple answer is, in order to try and get it down, it will take resource. We will have to direct resource into it. And with the now joined-up approach within the Community Care Directorate, we are hoping that that will give us the ability to release some resource in that area. But what is important as well is, Mr Speaker makes the point, Mr President, about the 12 weeks, and you wouldn't leave someone with a broken leg for 12 weeks. Certainly we do need to get the times of referrals down, but what we need to also look at is the way we are prioritising cases and making sure that those that are the most urgent are the ones that are dealt with first. And Mr Speaker, I'm sure would confirm, Mr President, I have dealt with them over several cases, and that is where we've got to have our focus.